So during your exam, you must know about three types of isolation: contact precaution, droplet precaution, and airborne precaution. Where you also need to know like what you're gonna wear it when you enter the room. So the diseases, you also need to know what diseases come under which category. So under contact precaution, the mnemonic is Mrs. V. That's the mnemonic you will remember, Mrs. V. M stand for MRSA. R for respiratory, respiratory syncytial virus. S for skin infection. W for wound infection. E for enteric like C. diff, and another E for eye infection like pink eye or conjunctivitis. So you must know what comes under which category. So you must always wash your hand with soap and water when you taking care of contact precaution. Now the next thing is you must wear gloves plus gown. Patient must have either private room or cohort. Cohort means if the another patient has same disease, like both patient has C. diff, then you will use both patient in the same room. And you must use their dedicated equipment. Like you must use, if you are using their stethoscope or blood pressure cuff, then you must clean it. Must clean. They have to have their individual stethoscope and their individual blood pressure. Each patient has their own. And if you're using it, must clean it, okay, before, after use. So that is come under contact precaution. So how you gonna remember that you have to wear gown and gloves? So just remember this way. So that under contact precaution, you want to get your house paint, and you have called Mrs. V to paint your house. So once she paint your house and you want to see your house, because the paint is wet, so you want to protect your clothes, which that's mean you will wear gown, and you don't want to touch the paint, and you will wear gloves. So that's how you will remember this trick, that what you need to wear, gloves and gown. Again, you have called Mrs. V to paint your house. She has painted your house. Now you want to see, but the paint is wet, so you're gonna protect your clothes by wearing gown and gloves. Also, mask and eye protection. If any bodily secretion, if patient has any bodily secretion, you must also wear mask and eye protection. So that's under comes contact precaution. So the next one is airborne precaution. So under airborne, there is a mnemonic that you need to know is my chicken has TB. My chicken has TB. M stand for measles or Ebola. C stand for chicken pox. H stand for herpes zoster, and TB stand for tuberculosis. My chicken has TB. So imagine that you are on aeroplane, right? You are on aeroplane and this jumps where germs float and fly. That's how the airborne disease spread, where germs float and fly. Now what you have to wear? You have to wear standard precaution. You have to take standard precaution with N95 mask, fitted mask. When you say standard precaution, that means you have to wear gloves and gown. Gloves, gown, wash hands with soap and water. Additionally, you have to wear N95 fitted mask. What else? So patient must have a negative pressure room. Negative pressure room. Door close all the time. Negative pressure room with door close all the time. If you have to take patient for any appointment or anywhere, the patient must wear surgical mask. Try to limit the appointments and also try to limit the patient movement. Limit the visitor as well. Patient must have to have very less visitor. That's come under airborne precaution. So imagine you are flying in an aeroplane. The aeroplane door must close. Negative pressure room. N95 fitted mask. And the last one is droplet precaution. So this is spread through sneezing, coughing, or talking. So the mnemonic for this is Spider-Man. SPIDER man. So S stand for sepsis or scarlet fever, strep. P for parvovirus, B19 pneumonia and pertussis. I for influenza, D for diphtheria, E for epiglottis, R rubella like German measles, M for mumps, meningitis, A for adenovirus, N for there is nothing for N. So you have to have standard precaution which covers under gloves and gown with surgical mask. The patient must be in private room or cohort. That means same infection. Door close always. If there is any movement that patient going out of room, must have surgical mask. So you must know about droplet, airborne and contact precaution. Always wash your hand before and after.